Hello friends, anywhere, anytime, at any age, a stroke can hit anyone. Just like diabetes started appearing at a young age, just like heart attacks started happening in the young, now stroke cases are rising among youngsters too. Paralysis is turning into a global pandemic and unfortunately it has started troubling Indians on a large scale. We are seeing it at very young ages. No drinking, no smoking, no bad habits. Still, it is not sparing anyone. Even with a good lifestyle, even when someone is very health conscious, it is happening. So then what is a stroke? What exactly is paralysis? Why are young people getting it? What warning signals come before a stroke? How do we prevent it? We will explain everything in this awareness video. Please watch till the very end. The stroke epidemic begins. Every 20 seconds, one stroke. Yes, friends, what you heard is true. In India, every 20 seconds, one person gets a stroke, a brain stroke, meaning paralysis of the brain. The worrying part is, earlier, this was mostly seen in older people, but now it is targeting young men and women too. Last year, almost 30% of the cases were among people under 50. Experts say that genetically, Indians have a higher stroke risk compared to people in many other countries. Usually, poor lifestyle, smoking, drinking, these were the major reasons back then. But now, even with a good lifestyle, stroke is showing up. Last year, Nitin Kamath, founder of Zerodha, a very respected brokerage company from Bengaluru, suffered a stroke. But he was and is extremely fit, very health aware, but even he wasn't spared. Why? Let's first understand what exactly is a stroke. Friends, a stroke, paralysis is a medical emergency. You know this, our entire body is controlled by the brain. This is the command center. If the brain doesn't get proper blood supply, a stroke occurs. Why does it lose blood supply basically? Sometimes the blood vessels going to the brain may get blocked or there may be bleeding inside the brain. That can also cause a stroke. This is why sometimes after a head injury in a road accident, people may get a stroke. In medical language, this is called a cerebrovascular accident, a brain attack. Body stops working when a stroke occurs. The part of the brain that loses blood can get damaged, sometimes temporarily, sometimes permanently. That effect depends on which part of the brain is damaged and how much damage has happened. If the left side of the brain is damaged, or stroke hits the left side of the brain, the right side of the body becomes paralyzed. Right arm, right leg, right side muscles stop working. And sometimes there is no sensation. If left brain is affected, speech gets affected. Sometimes people cannot understand other speech. And both eyes also lose vision on the right side, meaning this visual corner stops working. And the person also acts very fearful and becomes very slow in movements. But if the right side of the brain is affected, the left side of the body becomes paralyzed. If something is placed in front, you cannot judge how big it is, how far it is, or what position it is in. And in this case, the person may make fast, jerky movements. People around can even get hit accidentally. Both eyes lose vision on the left side. Here, in both cases, the severity depends on how big the stroke is. If it is a small stroke and if treated within the golden hours, roughly 4 to 4.5 hours, many effects can be temporary. But if the stroke is severe and treatment is delayed, there can be permanent damage, a permanent paralysis. You will be surprised. After heart-related diseases, stroke is the second biggest killer in the world. And in India, after heart disease and lung-related diseases, stroke is third because we have a very high pollution level. So, why does it happen? There are three major causes. Atherosclerosis. This means the arteries supplying blood to the brain get blocked. Around 80% of stroke cases happen due to this. What increases this risk? Age, high BP, diabetes, obesity, smoking, alcohol, heart diseases, all of these are risk factors. Also, if someone is overweight and snores while sleeping, their oxygen levels may drop. So, heavy snoring and continued snoring, chronic snoring, can also become a warning signal, a risk factor. And next, embolic stroke. This is when a blood vessel gets blocked somewhere else in the body, and that blood clot travels to the brain and blocks a vessel there. This risk is higher in people with heart-related conditions or family history of heart disease. Now, why is this happening in young people? Because of intense physical activity, over-aggressive gym workouts, adventure sports like bungee jumping, high stress, poor sleep, not drinking enough water, dehydration. And for women, within the first 7-8 months after childbirth, if they take oral contraceptive pills, stroke risk increases. And next, there is hemorrhagic stroke. Here, the blood vessel in the brain gets damaged and starts bleeding. High BP or head injury increases this risk. Body gives warning signals. Yes, this is important. If you notice these signals and reach a hospital within 4 to 4.5 hours, you can survive and recover faster. Within this golden hour window, doctors can give injection medication that prevents clot formation and helps restore blood flow. So what are the symptoms? Signals from the body as blood vessels start blocking. These symptoms slowly begin. Numbness in hands and legs, numb feeling in the face, lack of sensation, vision problems, both eyes blurry, or one eye blindness. In extreme cases, difficulty speaking, not understanding others, loss of bladder bowel control. Urine or stools may release involuntarily. If any of these symptoms appear, rush to hospital immediately. Important. People with the high BP may not show early symptoms. Everything may seem normal, but stroke can hit suddenly. So BP must always be under control. If you delay treatment, stroke damage cannot be prevented. Milder strokes can be treated sooner, but severe strokes may need angioplasty or surgery to remove the blockage. Some patients need rehabilitation for months or even years. Families suffer too, because recovery can take a long time, and sometimes paralysis becomes permanent. So yes, preventing is better than cure. How to prevent stroke? The best way to prevent stroke is to maintain overall health. Eat healthy, maintain proper body weight, do regular physical activity, keep blood flowing well. But don't over-exercise. Excessive workouts can also disrupt brain blood flow. Avoid cholesterol buildup. It clogs blood vessels. Most important, stop smoking. Smoking collects clot-forming toxins in the body and leads to stroke-causing diseases. Another major issue is our mindset. Nothing will happen to me, I am healthy. These warnings are for others. This mindset is the biggest mistake. Experts say, never ignore symptoms. If you have BP or diabetes, get regular screening, control cholesterol levels, and you can avoid strokes in many cases. So friends, this was our effort to create general awareness regarding this new pandemic, the stroke pandemic. This is an awareness video. This is an educational video. Purpose is to create general awareness. If you like this video, please don't forget to like, and especially please share this report with everybody you know, because it can be life-saving. Thank you so much. If you haven't subscribed to our channel yet, we request you to do so. It is very important for a new channel like us. Let's meet again. Keep looking for better. Namaste.